Hello. Thank you for joining us for another episode of Shining Light on Shadows, a candid conversation about mental health. This is episode 31, and our guest is Jonathan Boorstein. We're going to be focusing on ageism in mental health services for seniors. My name is Neil Parekh. I'm the producer and co-host, and over there is my co-host Dawn Helmrich Newberg.
Hello,
It is so
everybody.
good to be here with you this evening. Dawn, you're doing well?
I am. I'm better than our last show. Anybody who's tuning in that watched the last show, I had a bad week. So my hair is actually curled today. So that's a good sign. How are you doing, Neil?
I'm doing well. I've definitely had a challenging day. Produced a show earlier today, and right as we were finishing the show, the entire internet went down. And hopefully, folks who are watching may have had some experience with that, but that certainly threw my afternoon off. But I will say that it's been a great week. Otherwise, I celebrated my 52nd birthday on Monday, and it's always my favorite day on social media, seeing all the messages and the notes and everything. And I came back had over the last 2 weeks, I've had successive trips to Atlanta for work, and it's good when it's busy, but also it's a lot to do and a lot to follow up with. Certainly challenged all of my kind of mental health kind of work that I'm doing and the things I had to focus on. But we're here, and again, just to remind folks, we're live on Facebook, Twitter, LinkedIn, YouTube, Instagram, and my personal website. We're live on my Facebook and Dawn's Facebook, and both of our Instagram channels as well. And one of the things, Dawn, we've had several great episodes. The last episode we had was with Aisha Sultan. No, was it? Aisha Sultan at the end of May, talking about a web series of shows on mental health she's producing. But I'm actually thinking about Amanda's show back in the beginning of Mental Health Month and focusing on Mother's Day. We have Father's Day coming up this week. Let's take a moment before we bring Jonathan on. We'll talk about your blog post a little bit later, but can you talk a little bit about Father's Day and kind of just reflect on that in terms of what it means to you?
So yeah, Father's
And we had Dawn talking about Father's Day, but I think we lost her for just a moment. So she will come on in just a second, I'm sure. And there we go. I think we have Dawn right there. We go, Dawn.
I don't know what happened. It just.
But go ahead and continue what you were saying.
Continue. So I was saying that Father's Day is an interesting one for me. I had a kind of a rough go with my dad growing up, and so Father's Day was always hard to find a card because a lot of Father's Day cards, say, oh, thanks for my wonderful childhood and thanks for all this. And but now my dad's 88 and I have a good relationship with him. And I cherish that very much because my mom passed away 5 years ago. And so I feel very grateful that he's still around and that I get to spend time with him on Father's Day. And I'm really looking forward to that. And what's really awesome is that my husband's family has welcomed him to their Father's Day celebration. So he gets to come with us up to Appleton and spend time with my husband's family, which is great. I can't hear you, Neil.
We'll talk a little bit more about him. You can hear me now?
Yeah.
Talk a little bit more about him later in the show in this context of ageism and seniors, particularly around mental health care. But as mentioned earlier, the focus of tonight's show is ageism in mental health services for seniors. I just want to say a quick hello to a few folks watching. My mom is watching from Hastings-on-Hudson, New York. Mom, thank you for joining us as always. Appreciate it. And I definitely would be interested in hearing your thoughts on the topic as we hear from Jonathan Boorstein. Apollo is watching from Philadelphia. Thank you, Apollo. Chitachi is watching from Fort Lauderdale, if I'm not mistaken. Chitachi, thank you so much for joining us. And then Jim Newberg as well, from the left side of the couch. In the same room, or is he kind of this through the walls? Right?
No, he's that way, and he's on the left side of the couch if you're facing the couch. He's on the right side of the couch.
Okay, so on the kind of on the right side, we'll just put him on the right side of the show. How about that? We have Arlene watching as well from Uptown Manhattan. Looking forward to seeing Jonathan and his famous hat. We have a graphic of Jonathan. You can see the hat that way. Unless Jonathan is going to scurry real quickly to get his hat, we may only be able to deal with the headshot that we have. Kate is watching from the chilly backyard. So for folks who may not be familiar, Kate is Dawn's good friend. I'd like to say my good friend as well, since I met her when I was in Milwaukee. She's also Dawn's landlady, lives downstairs from Dawn. Jim is her fiance, and he's over there on the other side of the wall.
He's my husband.
He's Dawn's husband. Did I not say that? Did I say something else?
You said fiance.
I said fiance. That's right. Been married more than a year, and I said fiance. How did that happen?
I don't
know. Yeah, but there he is. That's Jim. So let's go ahead and get to Jonathan. His friends call him John, and I'm going to count myself as a friend. I've known him for several years. He wrote a blog post. When you are older, your mental health is not a priority. Examples of ageism in healthcare: oversimplified explanations, interrupting the patient, directing questions and decision-making to caregivers, and discouraging the use of technology. This just scratches the surface of ageism. We'll focus on mental health specifically for this conversation. Welcome to the show, our good friend, Jonathan Boorstein. Jonathan, good
Greetings.
to see you. How are you? And I'm sorry that we have to disappoint Arlene. No hat.
We have hats.
We have hats.
All right. I will bring everyone up to date. I am a hat person, and the hat for which I am best known is this one.
There we go.
Which is a classic fedora made by Borsellino. It is at this point in time a vintage Borsellino because it was manufactured before they declared bankruptcy. They were then bought by some conglomerate, and they are continuing the brand name. However, because of the time of year, i.e. spring, summer, my other sort of hat now comes out, which is a classic Panama, but also in the fedora style.
There we
Very
go.
nice. Very nice.
Arlene, I hope we satisfy your need to see some hats from John. Patricia is watching from New York City. Patricia, thank you for joining us. And our good friend Stefan Kaplan says hi. Stefan says hi, Neil, Dawn, and my always forever partner in live streaming, Jonathan. Jonathan actually helped Stefan produce a great show that he ran focusing on photography during COVID.
It was photography and social media. There is information there basically about how to be a great photographer, as well as how to use social media very effectively. It is a treasure trove of good information.
Absolutely. But Stefan's giving you the hashtag attitude, which is
yes, that's my hashtag actually.
Jonathan uses it on social media. Arlene, please don't leave. Please don't leave. Just because you saw the hat doesn't mean you should leave. But my mom does say that now it does look like the real Jonathan with the hat. So, you have it when you create a persona, you got to live up to it, Jonathan.
It is interesting because the origin of the hat really came out of something that, oddly enough, this relates to being a senior. I happened to burn very quickly in the sun, and so I needed a broader brimmed hat. And yes, it is sunny even in winter. And I decided, well, if I have to wear the hat, I may as well make it a style statement. And somewhere over the decades, the hat developed this strange life or character of its own. My joke is, if I ever wanted to go around incognito, just don't wear a hat.
Don't wear a hat, exactly.
But as many seniors who have dealt with skin cancer know, you do want to protect yourself from the sun, but you do have to be careful. I've been so sun shy over the years that I developed, of all things, a slight vitamin D deficiency.
Interesting.
Which is among medical issues not up there in the top 10 and easily taken care of, but it's sort of like, oh, I'm now in my 8th decade and I'm actually going to have to partially expose myself to the sun.
Before we get into the meat of the show, I do want to take a moment to recognize Digimentors, the consulting firm that many of you know Sri Srinivasan started, and that I am a VP of Events and Communications. Many of the folks watching are colleagues of ours through Digimentors or know people through various projects we've done. But if you're not familiar with Digimentors, we do digital marketing, events, and digital programs such as this one, strategic communications, training and workshops, staffing and recruiting. We're also doing a lot of work around AI right now. And it's always, I'm always proud to say that Digimentors has given me the time and space to produce this show because it's such an important topic. So I want to thank both Srinivasan and our leadership team, but also all of my colleagues who come out to support the show and who have often even been guests on the show. So in particular, Apollo, who's watching from Philadelphia, and Stefan, of course, who's watching earlier, Patricia Kitchen. These are all folks who are very active. Rose Horowitz is watching as well, tuning in from Connecticut. She says, great to see you, Jonathan. Hi, Neil and Dawn. She's a frequent viewer. So thank you to all of my colleagues. I also want to say hi to my sister, Amy, who's watching from Seattle. Thank you for watching, Amy. So Jonathan, let's start off before we get into some of these issues around ageism and mental health services. Let's take a moment and just talk about the terms that we're using. Seniors, older Americans, people of a certain age. What terms are you more comfortable with, or what terms are more appropriate when talking about people who are several years older than me?
Well, you're according to the AARP, you are
I'm
now
a member.
They start trying to recruit you around 45. But humor aside, it's an interesting question because being a senior and older person is obviously a question of chronology. When, how old are you? It's a question of social services. When does society consider you an older person? And it is also a question of how do you feel about it? Do you feel like you're an older person? In our society, we say 65 is now a senior. You look at what various companies and organizations do, it can start at 50, as does AARP. It can be 55, somebody there split a difference. And even among seniors or organizations that really specialize in seniors, there is some acknowledgement of differences within the category. AARP, at least last time I looked, which is at this point 20 years ago, but I think this is still true, has a tier system depending upon your age. If you are a young senior, you get one set of publications. If you are a middle-aged senior, another, and if you're a senior, still a third, because they feel your interests and your needs change every 10 or so years.
Arlene says that she's been a member of AARP since she was 25. That's probably one of the younger members of AARP that I've heard of after picking up the magazine in a dentist's office. I will say I very proudly submitted my application as I approached my 50th birthday 2 years ago. I haven't taken advantage of any discounts necessarily or any of the content. Dawn is raising her hand on that.
I take all of the discounts.
Good.
They have awesome senior travel discounts, and they have a great rewards program. I highly recommend it if you're.
I'll take a closer look. I've gotten the text messages and everything. It was more. I actually, when I joined, I was actually more celebrating the fact that I was hitting 50, and that was enough for me. I actually put a big sign in our front yard. This was during COVID. People put out like in big letters, "Happy Birthday," and I had to put out a "Happy 50th Birthday" to advertise. I wasn't hiding it from anyone.
Well, I think in the interest of personal security against identity theft, perhaps a little bit of discretion about your exact age might be advisable if you don't mind a little bit of unwanted senior wisdom there.
Sure.
The ARP has, as Dawn pointed out, fantastic discounts. There's so many, you can't possibly keep track of them all. Quite honestly, when I book a trip, get something that's a little more pricey or whatever, the first question I ask is, do you have a senior discount? Do I get something for being AARP? And what usually happens is they'll say yes or no and what it is. Sometimes it's nominal. Sometimes, well, it's not bad. And occasionally it says, well, we don't, but let's see what we can find for you. So the takeaway there is ask.
Okay. So I'll just pull in two quick comments. Amy says she considers herself to be a young senior. I need my naps, but I'm still young at heart. Without revealing anyone's age, she's my younger sister, not too much younger. Patricia says a friend in my building and I refer to ourselves as venerable chicks.
I think you should make that a t-shirt.
Venerable chicks, absolutely. And apparently I've been 50 in Amy's mind for a long time. So that's a discussion we're going to have offline. And I'll just say that,
just remember, you're not a young senior. You're a senior in training.
Senior in training. And it doesn't even go into what my 12-year-old thinks about how old my wife and I are. She thinks that we're really, really old, but that's a different issue. So Jonathan, let's and Candice is watching from San Antonio. I want to give her a quick shout out, a close friend of both mine and Dawn from Milwaukee. Candice, thank you so much for joining us. Really appreciate it. So
we got a little sidetracked. I'd like to finish off something.
Sure.
As with many terms referring to what falls in this category of a minority group, different people in it have different preferences. Some people they're fine with being called old. Some like to be called seniors. Some like to be called elders. That's particularly popular among a lot of people in the lesbian, gay, transgender, queer community. Seniors is fine as a generic, assuming you don't mean a senior at high school. But if you're talking to an individual, ask how do you like to be referred to?
Sure.
I personally like to be referred to as antediluvian.
Antediluvian. I will write that down, Jonathan.
So it's not as good as venerable chicks, but it works.
So let's get back to the focus for this conversation. Ageism. in the delivery of mental health services. And again, your blog post, which if people haven't had a chance to read, I certainly encourage you to do that. When you are older, your mental health is not a priority. And you offer a few examples of ageism in healthcare, oversimplified explanations, interrupting the patient, directing questions and decision-making to caregivers, and discouraging the use of technology. Can you talk a little bit more specifically about ageism and mental health? What your experience has been like in terms of trying to get mental health services?
All right. Well, we take a step back. I have dealt with chronic, occasionally debilitating depression all my life. I've made a number of attempts over the years to address this. They did not go anywhere. However, a few years ago, when I was a newly minted senior of 65, I now had my Social Security card, Medicare, and I even signed up at the what for me is a local senior center. I signed up with SAGE, that's for gay and lesbian seniors, and discovered that among other things, they did offer some psychological services and counseling. And I decided, okay, I'll give this one last shot and would see what happened, despite the fact that from my knowledge of what frequently happens with older patients is they really don't think they can be helped. When they do is they basically turn them into prescription drug addicts. And if you're, we'll give you enough happy pills and it won't matter. Well, it does matter. We should get the same level of care and concern as a younger person does. And I should add briefly that in some cases, psychology seems to make that bar even far below 50. It's more like 30 in some cases. So like, wait a minute. that's rather shocking if you think about it. So I go there, and there were two levels of screening. There's what they call pre-screening or preliminary screening, and then done by a social worker, and a more serious level that was done by an actual psychiatrist. The social worker was a very nice young lady, fresh out of social work school. I put in my short version of what happened there in the blog post. It was not promising, but it was not enough to deter me. Got to the psychiatrist, and the first thing he wanted to discuss is what drugs to prescribe. Not what course of treatment, what drugs to prescribe. Now, you can argue that prescribing drugs is a course of treatment, but I wanted coping mechanisms. What could I do to do things better? What could I do and press other than pop another pill? So I sort of argued him away from immediate prescriptions and started the therapy sessions. The person was very nice, but every few sessions we were discussing, let's talk about what we can prescribe you again. Not so helpful on coping mechanisms or simple things like how to manage what you have to do, administrative issues. Ultimately, it did occur to me, I really wasn't getting anything out of this, although it was great to hang out at SAGE, but I don't need to have an appointment with a social worker to do that. They're on 28th Street and 7th. I'm on, just below Union Square. It's an easy and pleasant walk. And I can even stop by Rizzoli. So, that ended that. And I basically took the point of view that, okay, this is not working for me personally. And I'm at this point, late 60s. I said, okay, I will just say, is this how I want to spend the rest of my life pursuing this? The answer was no. You only have so much time. Average life expectancy is 78, I think, at this point. In my family, it's closer to 80, 81, 82. I have other things I'd rather do. In a moment of what I refer to as senile dementia, I started a website. That's more interesting. It's hampered by, my bouts of depression, but, it's still something that's more interesting to do. And ultimately perhaps more profitable in the sense of it gives me something.
That's
What then happened?
Flamenco in New York
Yes.
is your website. If folks are interested.
I'm passionate about flamenco, and there is no website quite like mine anywhere covering every single flamenco performance I can find in New York City. If you're in New Jersey, you don't get listed. If you're in Connecticut, you don't get listed. It has to be New York City. Even Nassau County isn't good enough. But humor aside, then you discussed your own mental health journey, which dealt with depression, and your discovery that perhaps it was not depression, but rather adult attention deficit disorder. And this caught my attention because it would be a legitimate reason for me to revisit this issue that I had closed, because if it was a false diagnosis, that explained why it never went anywhere before. So I duly went on the website, tried it out. I was in the gray area as to whether I had adult ADHD or not. So I hit the buy button for the more serious test, which included a consultation with the presiding physician. And what I think for a lot of people would not be described as good news, although because I'm a doctor's brat is good news. The doctor explained to me that no, I had depression, which meant that I did not have a misdiagnosis. Not having a misdiagnosis is actually good news. It means we all know what we're dealing with. There are no surprises. That doesn't say I wasn't depressed by it, but it's let's use that.
Yeah.
But in terms of taking that test, initially I was not able to take the online test. The app would not let me do it. When I spoke to the website's extremely able staff, they're really wonderful. They did a few backflips to make this work. They somehow diddled my birth date. So instead of being in my 70s, I was now in my early 60s, I think actually 60 exactly, just so I could take the test.
Yeah.
Now, this leads us to two questions. One is, if the test isn't geared for people my age group, how accurate is it? Well, given the diagnosis is consistent with earlier diagnoses, I personally don't have to worry about that. And we all know that, but I'm not the only older person who might have this problem. By older in this case, I do mean senior citizen. I do mean an elder.
Mm-hmm.
The doctor happened to have mentioned that he has perhaps a handful of other patients in this age group. Well, that's a handful. It's probably the tip of an army that is not getting the right treatment. I subsequently found out that the test itself is not even approved for people over 65. And this circled back to some of the research I did for that blog post, where they commented that a lot of these studies for treatment do not cover seniors, because 65 is very much the traditional cutoff for most people.
Yeah.
So that was a bit of a surprise. On the other hand, I actually have I think the site has a lot of important stuff there, and it's going to help a lot of people. So I have a positive, contrary to what you think, I have a very positive feeling toward them. Didn't work for me. Okay, fine. The more minor point was that the people running the site took the extra step to try to find me someone who could help locally. And they sent me 3 recommendations they could find. I duly went on the link, checked it out. As near as I could tell, none of them took Medicare.
Mm-hmm.
So being I'm an ex-journalist, and as we all know, there's no such thing as an ex-journalist. Began to poke around and found a place that did seem to take Medicare, score 1, was literally, not figuratively, literally 4 blocks from me, score 2, and then suddenly realized I've been here before and it didn't go anywhere. I'm not going to do this. I'm not going to pursue it. But the site where the links went to is run by Psychology Today. It's a very thorough site. And one of the sources, if you are looking for help, could be useful.
Mm-hmm.
I can tell you that much as a journalist. I was able to, what is the phrase, synthesize the information, the data.
Well, as a good journalist, you did some research for your blog post, and one of the sources you shared highlighted what is ageism in healthcare. Approximately 1 in 5 Americans over age 50 experience ageism, and it's based on misconceptions about them having certain characteristics such as depression, loneliness, apathy, immobility, cognitive decline, anger, and stubbornness. Are those, outside of these attempts to get care, have you had people kind of have these misconceptions about your situation?
Yes. Essentially, I'm a what's called a lifelong learner. I'm always taking courses and things. I'm always trying to learn new things. I find a lot of younger teachers simply don't have the patience to bother to teach me. And when I insist, they feel I'm being stubborn. No, I am insisting you provide the service for which I paid. That's not being stubborn.
Hmm.
Loneliness, I'm a solo act. I'm an introvert. I can see how that's probably increased a bit as I've become older, but I've been dealing with that all my life. I don't know that I could quantify that, what the change is. Apathy, how to put this politely, not me. You don't, start a website because you're apathetic.
Sure.
You don't share posts on what's happening politically because you're apathetic. You may not be willing to march on the front lines, but no, you're not apathetic. Depression I've covered. Again, it's me. That's my normal, for better or for worse. Immobility. I have both balance and mobility problems, and I spent an inordinate amount of time and effort to get myself off a cane. I am now fine on flat surfaces. Stairs can be iffy, and there's some stairs I cannot do. But to be fair, there were some stairs I couldn't do even with a cane. Some people, I get that in both directions. I get some people receiving me as being not as physically able as I am. And I also get people who see me as being more physically able because of all that work I put in. It's physiotherapy. It's the Alexander technique. Even though I have a stent, I'm still doing martial arts, though obviously no contact.
Mm-hmm. Mm-hmm.
The auto specifically.
So I want to bring Dawn into the conversation. She wrote a blog post that looks at ageism and kind of elder care to a certain extent, focusing on her father. So Dawn, the blog post, watching my dad get older gives me a new perspective on aging. Mental health gets more difficult the older we get. Things change rapidly, and sometimes the elderly get left behind. Make sure they're getting what they need to stay socially active and not isolated. I asked you to talk a little bit about your father earlier with Father's Day coming up. Can you talk a little bit more about kind of what you've observed and kind of your perspective on this?
Sure. And just to note, my father calls himself elderly all the time. He is 88, so he's probably in the upper tinge of older, and does not act nor look like he's 88 years old. He is stubborn. He does have mobility issues. And those two things go together. He's got real bad balance issues, but he does not like to use a cane, a walker, anything to help him along. But he's gotten to a point where I will usually come to his important healthcare appointments for the simple fact that um, oftentimes his healthcare providers talk really, really fast. They if he wants to stop and write stuff down, they don't like him to do that. If he asks them to repeat things, they get frustrated with him. Um, and so it's helpful to have me there simply so that I can advocate on his behalf, because as an elderly 88-year-old man, even when he tries to advocate for himself, it doesn't always work. And and I think about his mobility issues, and he still drives a car and he goes places all the time. Um, and but I worry when I think of, older adults who don't necessarily have that kind of mobility or ability to be able to you know get places, and don't necessarily, like my dad. It's really hard for my dad to do like a WhatsApp video conversation. Like my brother lives in Texas. It's to get him on a screen is really complicated for him. And he didn't grow up in that era of internet. So a lot of it just doesn't make a lot of sense for him. So he can't do telehealth appointments unless somebody's there to help him do telehealth appointments. And he can't, and he'd probably, if he was watching this right now, he would probably refute me and say, I can do it. Because he is very stubborn and doesn't like to be put in that box. But I think that it is true that there are so many difficulties and limitations in healthcare in general and mental health care in particular, for people the older that they get. So my blog was really just about checking in on your people and making sure they're getting what they need. Not that my dad needs constant assistance. He doesn't. But he gets lonely, and it's important for him to have companionship and to see his daughter and to see his grandchildren. It helps keep him socially active, and I think that's very important for everybody's mental health.
Absolutely.
I'd like to add two things to that, one of which is my mother would call me several times a day. Basically, she was bored and wanted to be entertained. This did not help me get work done, but I did the best I could. And two is, this is something I've noticed not just from my own experiences, but as experiences other adult children have had with their parents when you become the parent to your parent, is that I think it falls in the category of stubbornness, where the older parent does not want to be a burden to the child and thus complicates the issue of trying to help the parent.
Yeah, for sure. I can guarantee you that my dad would call me every single day if he didn't feel like that was too much or a burden to talk to me every single day. Yeah.
And I think
it's sort of like these are the realities, and if you're an adult child, which is a whole different story than ageism, you have to deal with, and you have to know how to deal with it.
What I would say, I would jump in, and hearing those two perspectives, obviously John talking about kind of your own experiences, and Dawn reflecting on your father. Anything, any kind of ism really is based on assumptions, based on stereotypes, based on not really listening, not really understanding who you're speaking to and what their situation is. I think that there's a whole range, and that's what we people tend to forget that you can't paint a broad brush against anyone who you perceive to be over a certain age. I know my mom is watching, and I'm looking forward to seeing her comments on this. She's had a couple of thoughts already, just in terms of
earlier, but I do not know where.
Yeah, in terms of these symptoms that we talked about earlier don't apply to everyone. It's a subjective matter. It's really about how you feel about your age. But more importantly, her experience, particularly, and if it's okay, Mom, if we go there for a little bit. My father passed away 15 years ago now, 16 years ago in December, and she's been incredibly independent. She's always been independent, but she's even more independent now. And we've had relatives and others sit around commenting about how they can't believe she's able to get everything done that she needs to do, get where she needs to be. It really is. I don't think you can. When you see someone who is older, objectively, I think of that as someone who's, maybe 15, 20 years older than me. You have no idea what their life story is. You don't know what their challenges are or what their, how good or bad things are going for them. And I guess I'm raising that concern is it's one thing if I make an assumption about someone or if someone on the street makes an assumption. But we're talking about medical professionals. We're talking about healthcare professionals when they see someone in their office, not taking the time to really understand what someone's situation is. I think that's a huge problem.
There's, in addition, to borrow a concept from the feminist movement. Feminists really discuss something called mansplaining. I think many seniors have to deal not as much with mansplaining as what can be called brat-splaining.
I think Arlene has a great example of that. It's a little bit of a larger comment, but she once approached a group of 20-somethings and at an event, and they said, "We're on Instagram. Do you know what that is?" And Arlene, I can tell you, and she's been a guest on the Sunday show that we do. She knows her way around social media fairly well. She gave them a withering look. Not only am I on Instagram, I know all sorts of social media, some that they hadn't heard of. And that's really what I'm getting at, is that don't assume things about people. And that's across the board.
Sadly. And Arlene's, I think I follow Arlene on Instagram, Facebook, and someplace else. But, seniors use social media for the same reasons anyone of any age does. Probably seniors are best known for using social media to get in touch with their grandchildren, but other things as well. Arlene's being one good example. I'm on Facebook, Instagram, Blue Sky, and LinkedIn. LinkedIn is my weak presence, but every so often I give it another go. I don't feel I need for any more, but that's more of a time management issue than it is a reluctance about social media.
Mm-hmm.
The one thing I do find difficult about social media, which is a senior thing, is the print is so small. And you can't always do the little to get it larger.
Sure. Another point that was in one of the articles you shared, and this really starts getting into that question of institutional ageism when there's exclusion from clinical trials.
Mm-hmm.
So a couple of points there. Among clinical trials published in leading medical journals between 1998 and 2015, 30% had an upper age limit and 90% didn't justify it. Some clinical trials for COVID-19, I didn't actually know this, did not include older adults, even though the virus disproportionately affected them. And the underrepresentation of older adults in clinical research means some interventions need more evidence for safe, effective use in this patient population in older.
I'd like to give an example of this.
Please.
My grandmother, who is about 4'10", although she maintained she was 5 foot tall. And because she was also very delicate boned, when the doctors automatically prescribed her an adult dose, she essentially had an overdose. But if you gave her a children's dose, excuse me, I forgot to turn something off here.
No worries.
When she took a children's dose, it worked perfectly. They were not looking at age, height, weight. All they knew was, oh, adult, this is the prescription.
That's crazy. That's terrible.
Yeah, no, I mean, that's, my mother, who could be difficult, the sort of the one who sort of figured that one out faster and essentially became something of an expert in elder care, whether she wanted to or not, just to stop the overdosing.
Yeah.
My mom also shares that doctors have a preconceived notion about age, and they feel that this can happen during old age. And she says she opposes and clarifies that I feel different about my age, that she feels young. So it really is also a question about being a good advocate for yourself in any medical situation. That's almost just as important.
What I have taken to do, and I don't necessarily recommend everyone do this, is I have what I call my one sheet, which is a piece of paper in which I list my basic medical information, what my medications are, what my known conditions are, what are conditions we are looking into, and it's all boiled down to one piece of paper. And that does two things. One is it tells the doctor I'm on top of my medical situation. And two is it turns out to be a lot easier to read than what they're doing on screen. Which I didn't realize the first few times I did it.
So you actually take the paper with you and hand it
Yes.
to them?
Yes.
That's really good thinking.
I am. The other thing about being old is you get shameless. You're going to get this document and you're going to read it.
Yeah.
Sure.
And by the way, a lot of doctors have no problem with that piece of paper. I think one young doctor was just like, looked at it and said, wow, this is fantastic. It was like, I don't know if I wanted that degree of enthusiasm, but as long as you pay attention.
We have a couple of comments on Twitter I want to just bring in. Gary McLean says that this conversation is very important. He's a therapist and author with a focus on adults in transition, work, health, relationships. Mohammed Atif El Meligi is saying that it's essential to prioritize mental health services for seniors, as ageism often overlooks their unique needs. Conversations like this help illuminate those challenges and drive change. It certainly is a topic. It's something we haven't actually discussed on this show in detail up till now. And what I'm finding, Dawn, and as we continue, we're in our second year, episode 31. There are still lots of areas to explore, a lot of topics that we can consider around mental health. We conceived this show as an idea of helping to lessen the stigma around mental health. And I think that even for me personally, I was, there was maybe a little bit of self-interest in terms of being able to talk about my own mental health issues and, be more comfortable about that in a public environment. But what we're finding is that we're now able to kind of illuminate other issues, other concerns that others are having, whether it's, seniors, whether it's specific populations, etc. So I'm really glad, Jonathan, thank you for joining the show this week. It really started as an email exchange where we talked about the importance of senior care, and then when I said, well, John, would you consider being a guest? And his answer was, well, I'm a senior, and I have thoughts on mental health. Yeah, sure.
Also, I'm sort of like, I'm not really a member of Digimentors, but somehow I'm like a crypto member of
You are
Digimentors.
absolutely a part of the family. One question I wanted to ask you, John, and you mentioned it, made a reference to it earlier, but um, one of the first times that I had a chance to interview you was for a show for our Sunday New York Times read along for a special show during Pride Month. This was, I think, 2 or 3 years ago.
About 3 years.
3 years ago. So I wanted to ask you, this isn't, a focus of this conversation, but as, and maybe I know we will have a separate conversation about this in October. A friend of mine from Seattle, Talal Hattar, is going to join us on a few days before National Coming Out Day, and talk about some of the issues he's dealt with. But can you talk a little bit about mental health and the LGBTQ population? Are there specific issues, or does it hit differently for people who are gay?
There are a couple of really unfortunate issues. One of which is, as a subculture, the queer community is very youth oriented, so you wind up being aged out very young, and that's one thing that's unfortunate. It also encourages a lot of older people to try to be young in the bad sense of the term. You're not going to look good in the latest fashion. It's better to stick to age appropriate clothing and things of that nature. Obviously, if SAGE was running a program which provided mental health services, it is a major issue. There is a greater degree of loneliness. There is a greater degree of alienation, because you not only have the alienation due to age, you have the alienation from the mainstream.
Thank you.
Sometimes there are some people who are very fortunate. They are able to turn being an elder into a style statement, or they are able to just remain mostly politically active, and that kind of keeps them in the gay and lesbian, transgender, queer loop. But for most people, SAGE is about the only thing there, and it's traditional senior type activities, except the people are older, mostly called elders, is how it is referred to. There are a number of other special programs, a couple of documentaries that are dealing with it. It's mostly oral history. Some of it touches upon psychological issues.
Got it. I want to bring in Stefan, raised a comment rather. Our good friend Tim McDonald is always the biggest cheerleader for people being their own healthcare advocates. We talked about that earlier. And his case
secondhand, but very much so.
Through his journey, battle, and victory over colon cancer, Tim is actually watching, and he says, Stefan, and still advocating. So
good
Tim,
for you.
Thank you for joining us, and I appreciate you watching this evening's show. My mom says she likes
about to steal an idea from me.
She likes your idea about the writing details on paper and bringing it into a doctor's appointment. Certainly a great way to be an advocate.
It makes it clear. I also write out my questions in advance. One doctor sort of realized how neatly these were all written, grabbed a piece of paper, wrote down the answers for me, except being a doctor, the handwriting was totally illegible. Basically, that's all you can do with that one. Fortunately, yeah. My memory is still kind of working.
That's good. That's good. Folks, Shining a Light on Shadows is a show that Don and I have been co-hosting for a little over a year now. We air the show 2 times a month, the second second Thursday and the fourth Thursday of the month, with the idea of having an open and honest conversation around mental health and mental health issues. Some more comments coming in. My mom says that people should pursue their interests and hobbies. Jonathan certainly does that with his flamenco website that he mentioned earlier. And I know that he was able to point my sister toward some good flamenco in New York when she was visiting recently. So thank you for that.
You can you can literally attend a flamenco show a week in New York, and in fact, more than one a week.
Don, any thoughts as we start wrapping up today's show?
Yeah, I think that this has just been such a enlightening conversation, and like I said, having my dad be in his upper 80s, I certainly have taken away quite a bit from this, Jonathan. So I really greatly appreciate that. I think that mental health and healthcare is so difficult to navigate under normal circumstances. And I think when you complicate that for individuals who are getting older, that is something that really needs to be addressed. And I don't know that I necessarily know the right avenue to do that. Probably more training, more classes during, college about, how to treat people who are older. And I don't know, got any suggestions, Jonathan?
One of the sites that I found when I was doing research for my blog post, probably over-researched it, was from Baylor Nursing Online. I think the link is posted somewhere here. That was the most comprehensive one that dealt with identifying ageism and listing, or at least giving someone an insight into the list of things you have to do to avoid it, or at least what you need to look at and build on for a better thing. It's difficult. I think for many people, it's going to be like learning a new language.
Mm-hmm. Yeah, definitely.
And I'm sharing that link in Facebook to the Baylor College of Nursing.
That was the one that you liked, also.
Yeah.
I also have there. I also quoted from a little bit of a human interest approach from NPR that has some good information as well. I think there was an estimate that ageism costs the healthcare system approximately $63 billion a year.
Yeah,
which is a shockingly high number.
Yeah.
And so I shared links to your blog post earlier in the chat, and those articles are all available in the
Perfect. Thank you.
Blog post that Jonathan shared with us for this show. Again, thank you for joining us this Thursday evening. We appreciate sharing a little bit about your experience in terms of reaching out for healthcare, for mental health, some of the challenges. I do want to make sure that we share some resources with people before we go. It's something that we try and do every episode, particularly in terms of if people are looking for support. NAMI is a good resource, and there you can reach them at 1-800-950-6264 or their helpline. It's also NAMI.org, NAMI.org. We know a number of people have found a lot of support, especially through their community groups. There's also Mental Health America, and you can reach them through their 988lifeline.org website. They run the suicide hotline as well, 988. So we want to make sure people are aware of that. And then, Jonathan, one thing that we didn't talk about on this evening's show, but it's something that is always top of mind for Dawn and I as survivors of sexual assault. But we always want to make sure people have the information about RAINN, the Rape, Abuse, and Incest National Network. Every 68 seconds, an American is sexually assaulted. Obviously, the impact on mental health can be profound for folks. And I would say for folks who may be older, are elders who have had these types of experiences but have not had a chance to talk about it or process it, it can be even more important to know that these resources are out there.
If I may interject something a little bit to
Please.
the side of that, many years ago, I was jumped by a couple of people because I have a background in martial arts. At that point, it was just Western fencing. I fought them off, and they wound up running away from me. And as a result, I sort of said, okay, I was kind of lucky. This is something you sort of like understand if you've done any sort of martial art. I'd better get some training so that if it ever happens again, I will be better able to defend myself. We will not go into the questions of like, well, I just did effectively defend myself. That was the department of the people. I came across a group called Safety and Fitness Exchange, and they no longer exist, but they had an interesting trajectory, which is they started off as trying to teach children how to defend themselves if they were attacked, went on to women, went on to the lesbian and gay community, and then finally realized everyone needed this. Now, I'm not suggesting everyone go out and sign up at Tiger Schulman or a place like that where you will not learn how to defend yourself, I should add. But it is being attacked is more common than that number suggests, and not everyone reacts the same way. I was tall enough, strong enough, trained enough, whatever, that it didn't go anywhere. It's sort of an anecdote I occasionally tell at this point when it's appropriate. But for a lot of people, it's very serious. They can't talk about it. They can't even go through the thing, because what happened to me was that, being a proper, slightly snotty, good citizen, I, of course, reported it to the police and then agreed to some sort of follow-up questioning after the police finished questioning about the attack. And I kept thinking to myself, they've done everything except actually try to find who attacked me, but certainly prolonged the agony of it, which was totally unnecessary. So, that number I feel is low just because of my personal experience.
Well, I think it is low because oftentimes people don't report.
Exactly, yes.
Both men and women don't report because there's such a stigma, and there's a lot of victim blaming that happens when something happens to you. So, and a lot of times women in particular are not believed. So I think it is very low. I'm agreeing with you. I think it's very low.
No, we're coming at that number from different perspectives, but yeah, no, sort of like, no, it doesn't feel right, even if you don't have any sort of personal experience to call on.
For sure.
We'll close with a couple of comments from the audience. Patricia is asking if there are any classes for venerable chicks to learn to do very basic flamenco. That might be something you can connect with her. I assume that you know Patricia. If you don't, I'm happy to make introductions.
No, we've met at a number of SRI events.
I thought you might have. But definitely, and maybe next time my sister is in New York, Patricia, she can join you for some of those. So she's not quite as venerable as you are, but she says she's getting there. But closing out some comments, Sudha Parek and my mom says, thank you, Dawn, Neil, and Jonathan, for the conversation. Stefan says, this has been a fascinating and insightful discussion, and there was no one better to have it with. Thank you for sharing, Jonathan. Arlene says, great show. Thank you for sharing your insights. And Rose says, thank you for a great conversation. Important topic.
Two last things. One is, since we started with my hat, we finished with my hat. And if for any reason you wish to refine the name Venerable Chick, how about Venerable Babes after the Venerable Bead?
Venerable Babes. There we go. thank you everyone for joining us. We look forward to seeing you on our next episode. Take care. Bye-bye.